Magandang gabi mga kaibigan. Welcome po dito sa Radyo Klinika sa DWIZ. Ako po si Maru Pahati Sarne. Ngayong gabi ang pag-uusapan po natin ay tungkol sa Bato. Narito po ngayon kasama natin isa pong urology surgeon mula po sa Philippine Urological Association. Wala po iba kundi si Dr. John Mark Garcia. Hi Doc, magandang gabi sa iyo.
Hi, good evening. Magandang gabi po.
Yes, Doc. Oo, ito nga, marami ang mga nakaka-experience nito, no, na yung pag daw umihi sila, ang sakit-sakit. Pagkatapos may biglang para mga kristal na lalabas doon sa kanilang inidoro. Bakit nga ba nagkakaroon ng mga crystal-like stones sa loob ng ating ng ating ihian?
Okay. So, pag umihi kayo ng crystals, one thing, mabuti at nailabas nyo.
Sakit nga eh.
Yes. It is actually more painful kung hindi mo nailabas. But before we go into that, so chances are, meron kayong tinatawag na kidney stones. Passed out kidney stones. It's actually quite common, especially in our climate. And the most common cause for that is actually low water intake. So very variable kasi no, pag sinabi nating low water intake. And especially sa climate natin, mainit, ang low water intake in a colder area is different when you say low water intake in a warmer area. So, different yung tinatawag namin na advised water intake per day.
So ilan dapat yung iinumin kapag lalo tayo mainit?
Recommendation talaga namin is around 2.5 to 3 liters minimum water intake per
minimum
day.
Pa yun, ha? Oo.
Minimum yon. Actually, ang nakasulat nga sa libro, for patients na nagkaroon na ng kidney stones before, 3 liters of minimum urine output. Ibig sabihin, more than 3 liters dapat ang iniinom in order for you to come out with 3 liters of urine output. So, hindi basis ang water intake. Ang actual basis pala talaga is the amount of nilalabas, yes. Yun yung adequate measure of hydration. So again,
yes, Doc, kaso sasabihin nila, teka, kasama ba dun sa 3 liters yung iniinom ko milk tea, at saka soft drinks, juice, at saka yung sabaw, kasama yon?
Kasama naman.
Kasama.
Fluid intake. Pero ideally, we always advise water intake.
Dapat tubig.
Ang particular natin na in concentration, kumbaga. Yun yung papansanin talaga natin, water intake. Problem kasi with, sabihin natin, fluid intake, soda naman pala yung iniinom. Soda is a risk factor, no? For stone formation. May iba dyan, Doc, malakas akong uminom. 3 litrong Coke sa isang araw.
Soft drinks pala.
Kaya po pala kayo may kidney stones. Kasi soda can be a risk factor for development of stones, no? So again, the first thing I mentioned was actually dehydration or low water intake. That is one of the most common risk factors for developing kidney stones.
Okay. Yung mga mahilig sa maaalat ba, nagpo-form din ba sila ng kidney stones?
Actually, that's true. Okay? So, high salt intake can develop kidney stones. But take note, meron kasing misconception dito na ang gagawin mong bato ay salt crystals. No. High salt intake will actually predispose you with a lot of things. I will try to avoid medical jargons, no? But salt per se, hindi ka gagawa ng salt crystals sa ihi. It will actually predispose you to create calcium stones. And it will actually predispose you to decrease yung may tinatawag kami na enzyme in the urine, which is your citrate. It will decrease citrate. Citrate kasi is a chemical that your urine produces to prevent stone formation. High salt intake will result in decreased citrate. So indirect, again, with high salt intake, hindi ka gumagawa ng salt crystals. But indirectly, you're creating calcium stones. Indirectly, you are decreasing yung citrate, which is panlaban natin with stone formation. So, pero in essence, yes, high salt intake will cause stone formation.
Nako. Paano, Doc, yung mga mahihilig sa mga snacks, sa mga chips, Di ba mataas yung mga ano niyan, mga
Yes.
asin niya. Tsaka yung mga noodles daw na
Yes.
kinakain nila. So,
So,
pwede. Na ito ang mag-contribute dun sa calcium formation ng stones.
definitely, oo.
Mm-mm.
So, for patients na nagkaroon na ng kidney stones before, part of our dietary modifications or part of our advice, please avoid chichirya. Please avoid instant noodles. Please avoid processed food. Okay? Kasi mataas talaga ang salt content ng mga yon. Pero admittedly, masarap kasi sila eh.
Oo nga. Pati yung
So,
mga canned goods, di ba? Tsaka, yun yung
definitely.
ayuda eh. Paano natin, paano naman yun, Doc? Anong kakainin kung yun ang
Okay.
ayuda?
In the event na ganun nangyari, okay, ang pinaka-totoong medical advice, avoid them. But in the
Mm-mm.
event that you have no choice, yun yung meron tayo.
Mm-mm.
Please increase your water intake further.
Mm-mm.
Kung sinabi ko 2.5 to 3 liters, eh puro delata ang kinakain natin, nakikiusap kami, pwede bang 4 liters ang inumin mong tubig kung gano'n ang nangyari?
So, naka-counter ng pag-iinom ng tubig itong
Yes.
kidney
Kasi
stone formation. Mm-hmm.
water intake really will flush out, no? Will flush out all the crystals that's being formed in your kidneys. At
Mm-hmm.
least mas madalas kang umihi, mas malabnaw yung ihi. So chances are crystallization is decreased, no?
Mm-hmm.
May tinatawag kami na term na tawag na supersaturation. Kumbaga, in a simple explanation, kung ang isang bagay ay concentrated, mas mataas ang chances na mamumuo ang crystals.
Mm-hmm.
Kung malabnaw, mas less ang chances na mamuo ang crystals. So please have a high water intake.
Mm-hmm. Okay. Yung iba sabi nila, magbuko juice ka na lang kasi mas maganda yan para lumabas daw yung mga bato mo sa bato. Totoo ba yun, Doc? Nakakatunaw daw yung buko juice ng bato sa bato?
Well, not nakakatunaw per se. Pero back to your first premise na, Dok, okay lang
Mm-mm.
ba mga juice? Kasama ba yun sa 3 liters na fluid? Yes. So,
Mm-mm.
if you drink lots of buko juice together with water, it's actually helping na mataas ang fluid intake mo.
Mm-hmm.
Other juices that can actually help you, cranberry juice, especially in women, alam nila yan, no? Pag nagre-regla, it's a good diuretic. So
Mm-hmm.
cranberry juice can help, buko juice can help. Pero let's try to avoid yung ibang mga juice na matatamis.
Lalo na yung mga nasa Tetra Pak o kaya nasa
Yes.
lata.
So ang gusto naman namin sa buko juice, hindi ganun kataas ang sugar content. So by all means, please drink your buko juice and drink lots of water as well.
Mm-hmm. Okay. So hindi totoo rin yung overdose ka raw sa sobra o kaya ma-over ka naman sa sobrang pag-inom mo ng tubig. Baka daw malunod yung ano mo, yung sistema mo. Hindi totoo yun, do?
Well, in general, hindi totoo yun. Pero we have
Mm-hmm.
to take it in the context in the elderly, yung sobrang may edad.
Mm-hmm.
In those patients na elderly, yes, may fluid restriction yon. Kasi may ibang mga organs na involved, like your heart. Yung concept na sumobrang daming inom ng tubig na lulunod, that's for patients na may ibang karamdaman, tulad ng congestive heart failure, or yung may mga kidney failure na talaga.
Mm-hmm.
But for the general public, let's say mga 20s, 30s, 40s na may kidney stones, no, drink all the water you want. I mean, all the water you can. In general, it's safe to drink lots of water talaga.
Mm-hmm. Yung kidney stones ba, Doc? Paano pumapasok yan? Paano nabubuo sa kidney? At saka nasa ang parte siya ng kidney? Nasa loob ng kidneys mo? Oo.
Okay. If you would allow me to share my
Yes.
screen,
Mm-hmm.
para imapakita ko din sa inyo yung itsura ng kidney.
Mm-hmm.
So, if you can see my screen, you have left kidney, right kidney. It's connected to a tube-like structure called the ureter, and then connected to our bladder or pantog, your urinary bladder, and goes out through your urethra, be it sa male or sa female. Okay. If we zoom in to our kidney, so meron tayong tinatawag, ito ang part ng kidney natin na gumagawa talaga ng ihi. I won't go again into the medical jargon, but try to imagine this part, your renal medulla, it will produce your urine. And then it will excrete it out into the collecting system. Ito ang tinatawag na renal calyx, and then this is your renal pelvis. And it will drain down into the ureter papunta sa pantog. Now, crystallization will start here, no? And then, ang
Dun sa medulla.
crystallization, yes. Ang crystallization, it will start microscopic. Eventually, if you drink, you have low water intake, hindi mo na flush out ang system parate.
So,
You have
nagbabara na siya.
high salt intake. So, ang theory dyan is yung super saturation. Dahan-dahan mamumuo ang crystals. Kapag may nagsimula, no? Pag may nagsimulang mamuo na crystal, it will attract more crystals and dahan-dahan siyang lalaki. It can grow in any part of your calyx. Okay? Nakadikit yan siya initially. Tapos pwede din siyang malaglag. Sorry?
At yun yung minsan na ilalabas nila, no? Na kristal.
Yes. So
Kaya lang, ang sakit nun, kung gagasgas ba yan sa ureter?
Yes. So, ang kidney stones, it can stay dormant, no? It can be asymptomatic, walang nararamdaman. Hindi mo alam na may kidney stone ka pala. Kasi dito lang siya sa calyx na muo. Ang pinaka-issue natin is, number 1, pwede siyang lumaki. Or number 2, pwede siyang malaglag into the ureter. Kapag nalaglag siya into the ureter, ang description niyan, it is as painful as giving birth.
Talaga?
As painful as childbirth.
Kaya pala
Dito
yung
talaga.
iba parang napapaluhod daw kapag umiihi. Dahil sa sakit,
Oo. Kapag ang bato nahulog into the ureter, it is so painful na ang patient talaga, the patient will need emergency room consult kasi kailangan talaga siya lagyan ng IV pain reliever. No? Pag nalaglag yung bato na yan at naipit into the ureter, dito kasi nauso yung size does not matter. Why? Because the ureter, the diameter is only approximately 0.5 centimeters. So anything beyond 0.5 centimeters, pwedeng magbara. Kung tutuusin, 0.5, parang butil ng bigas. So ganun kaliit, it will cause severe pain. Again, kidney stones that are floating, sometimes wala kang nararamdaman. Baka kasi may magsabi, Dok, may kakilala ako na may kidney stones, walang nararamdaman. Ako, sabi mo 0.5 lang, ba't ganun? Sobrang sakit. Chances are, nahulog yun sa ureter at nagbara. Kaya ka nagkaroon ng severe pain. So again, issue natin, kapag ang kidney stone na pabayaan, pwedeng lumaki. So the danger with the kidney stone that's growing, that's increasing in size, eventually it may consume the entire kidney. Tutubuan ka ng isang napakalaking bato in the entirety of the kidney that's now called a staghorn stone, which will necessitate surgery. So habang maliit sana ang kidney stones, better talaga sanang kita natin kaagad, maremedyohan natin kaagad to avoid major surgeries.
So bukod doon sa pag-inom ng maraming tubig, may mga gamot ba na dapat inumin para mailabas o matunaw itong mga kidney stones na ito?
Yes, that's a very good question. No? So apart from a high fluid intake, apart from good dietary control, so when I say good dietary control, pasensya na, iwas po tayo sa laman loob. Okay?
Papaitan!
Yes.
Bopis! Yan, iwasan natin. Dinuguan!
Kahit anong pagkain na narinig nyo sa mga nakakatanda sa atin na sinabihan ka na nakaka-gout yan. Yun yung mga pagkain na kailangang iwasan natin. So, laman loob, beer, okay? With regards high protein intake, animal meat. So that's your pork and your beef. You have to regulate it. Hindi pwedeng puro pork, puro beef ang kinakain natin. And then, you have to try to avoid yung isang planggana ng munggo. No? So, may mga pasyente ako na ang paborito munggo. Sasabihan ko, pwede ka naman kumain ng munggo. Wag lang yung isang buong...
Isang bandehado.
Oo, ikaw lang mag-isang
mangkok.
kakain. So, again, water intake, dietary modifications, and then we're going to talk about medications. So, yes, there are medications to try to dissolve these stones. Mind you, not all stones can be dissolved by medicine.
Oh no, talaga to?
Okay? There are stones na pwedeng ma-dissolve. And with that, we offer, especially if wala kang nararamdaman, no? Walang masakit. So walang emergency. Nakita lang natin na may stone ka sa kidneys mo na lumulutang, it's not causing you any pain whatsoever. Let's try medications. So sometimes the medication will work kasi nga it can be dissolved lalo na mga uric acid stone, but there are also calcium stones that may not get dissolved with medications. So we go to our next treatment modality. No? So our next treatment modality, apart from medications, may tinatawag kami na shockwave.
Yung lithotripsy ba yun?
Yes, your shockwave lithotripsy. Ang kinagandahan ng shockwave lithotripsy, it is an outpatient procedure. It is non-surgical, meaning walang hiwa, hindi ka bubuksan. I will just actually show you what it looks like para lang na makita ninyo kung ano ang ginagawa sa shockwave lithotripsy.
Pag hindi na nag-work yung gamot, isa shockwave
Yes.
na, oo. How about sambong, Doc? Nakakatulong ba yun para matunaw yung mga bato?
Sambong is a very good medication. No? So I always encourage my patients kasi nga may notion na ang Western medicine, we don't believe in herbal medication. No. Sambong kasi is a herbal medication with lots of study, and those studies were actually done here in the Philippines by UPPGH. They have a lot of publications with sambong that it really helps dissolve stone. Na-mention ko kanina, uric acid stone, madaling ma-dissolve with some medication. With calcium stones, mahirap siya ma-dissolve with your medications. Lately, some of the studies have been showing sambong is even effective in dissolving calcium-containing stones. So we are very happy with sambong. We really like to give sambong for stone dissolution. But of course, all medications have limitations. And part of those limitations are it depends on the size of the stone. And it depends if the patient is in pain. If in pain na kasi siya, we try not to give medications. We want to give an immediate treatment to relieve the pain right away. And of course, if it is causing obstruction to the kidney. When we say obstruction, nagkakaroon ng dilation to the kidney, we need immediate treatment. Hindi kaya ng medications yon. So going back to shockwave lithotripsy or ESWL, I'll share to you ano ang ginagawa natin sa shockwave. So in shockwave, it is an outpatient procedure wherein the patient is going to be placed on mild sedation. When you say mild sedation, very arousable, konting tapik lang gigising sila kaagad. Ipapahiga namin siya sa isang ganitong machine. And then through X-ray and ultrasound, we're going to look for the stone. And by means of shock wave, sound wave, we're gonna blast the stone to fragment it para, yes, mababasag siya para mailabas mo siya spontaneously.
So lalabas siya dun sa iyong ureter?
Yes.
Hindi ba masakit yun, Doc?
Well, you may have some pain, yes. During the shockwave procedure, tulog ka naman. So during the shockwave procedure, hindi siya masakit. Habang lumalabas yung bato, yes, you may have some discomfort. But ang notion dito, with shockwave kasi, binasag mo na to smaller fragments yung bato. So chances are lesser degree of pain habang lumalabas yung bato. Kasi mas maliit na basag na siya eh.
So lalabas siya habang nasa operating table pa yung pasyente?
No.
Hindi yung,
no.
Pagising na lang siya?
Shockwave natin siya.
Oo.
Habang nagsha-shockwave, nababasag yon, dahan-dahan magti-trickle down yung stones. So pagkagising niya, usually pagkagising niya, yung unang ihi niya, mapapansin niya, ay, may mga bato akong nailabas. So maganda ang shockwave. It can offer an immediate relief of the discomfort. It can offer an immediate release of the obstruction. And it's outpatient. And it's a very safe procedure. Yes. It's a very safe procedure as long as you don't have active infection and of course if you're not pregnant.
At saka wala nang hiwa-hiwa, di ba?
Walang hiwa. Hindi ka matatakot sa hiwa-hiwa. Walang instrumentong pinasok sa katawan mo.
Okay. Pero sabi mo nga, Doc, hindi naman lahat isa-shockwave. Depende sa laki nung kanilang
Yes.
bato. Ano yung pinakamalaking bato na nakita mo, Doc, sa kidney?
Oh, it can pinakamaliit. Usapan muna natin.
Sige, pinakamaliit.
I have patients who have very small stones, 0.3.
Mhm.
Pero pero yung na-experience nila na pain was severe.
Oh, talaga?
0.3 lang pero severe na yung pain na
Kasi
naramdaman nila
bumara.
kasi
Mm.
bumara. There are other diseases that can cause na yung tinatawag natin na chronic kidney disease apart from kidney stones.
Mhm.
Yun, medyo ibang field yon and ibang reasons nun. But kung bato lang kasi, very avoidable. I mean, it's very treatable so kayang-kaya sanang ma-avoid ang dialysis if kidney stones lang ang cause.
Mhm. Pero yung bang kidney stones, Doc, nakikita ba yan sa ordinaryong urinalysis lang?
It may. There are some
Mm.
clues. So some clues in your urinalysis is blood in the urine. Tinatawag natin na microscopic hematuria. Dok, clear naman yung ihi ko. Malinaw. Ano sinasabi niyong dugo sa ihi? Okay. In your urinalysis, may nakikita tayong RBC or red blood cells.
Mhm.
So that can be a clue na may bato sa ihi. Especially if the patient will come into your clinic na, Dok, may masakit sa tagiliran ko. Tapos nagpa-urinalysis ako, sabi wala daw akong UTI, pero may dugo yung ihi ko. That can be a clue for kidney stones. So our next diagnostic tool is a simple ultrasound.
Mhm.
Chances are you can find an ultrasound anywhere. Ultrasound is very common here in the Philippines. You can have it requested to check your kidneys and your bladder to check for kidney stones. So one of our mainstay diagnostic modality for kidney stones is an ultrasound.
So, pwede kang basta mag-walk-in sa isang diagnostic center, Doc, at i-request yung ultrasound or kailangan may doktor na magre-request niyan para sa'yo?
More often than not, the diagnostic center will request for a request from a doctor.
Okay. So, hindi pwede pa ultrasound ng kidney.
But
Kasi
mind
duda
you,
ako eh.
you can actually go to any doctor and tell them,
Oo.
Doc, may tatay
Bigyan mo
ko
naman.
kasi or nanay ko kasi nagka-kidney stones. Gusto ko sanang ma-check din ako. That's a very good attitude, no? Kasi kidney stones also has a genetic predisposition.
Pwede
Ibig
mamana.
sabihin, namamana, nasa lahi.
Mm-mm.
So that's a very good trait. Ako, I really appreciate those patients wherein magsasabi, Doc, mama ko at 40 years old may kidney stones. Ako 40 na ako ngayon. Wala naman ako nararamdaman pero pwede ba akong maghingi ng request for ultrasound?
Yes.
That's very good. That's a very good trait.
Okay. Paano naman, Doc, kung kunyari, nagkaroon ka na ng kidney stones, tapos umulit na naman. Bakit ganun? Kunyari, nagpa-ESL na. Pero eto na naman, nabuo na naman yung kanyang kidney stones.
Okay. So, again, the reason for stone formation is water intake, food, and then your genetic predisposition. Nagkaroon ka ng 1 centimeter stone, na shockwave natin, nailabas mo, na flush out natin. 1 month later, nag-ultrasound tayo, very happy tayo, wala ka ng bato. And then down the road, bumalik na naman yung low water intake, bumalik na naman yung mga party, especially kapag may fiesta, or Christmas, no?
Daming handa na puro
daming handa.
pork beef.
Aminin natin, depende kung saan kayo sa Pilipinas, pero ang Pilipino, ang sarap kumain.
Oo,
no?
Totoo yan.
And then, yes, once you're a stone former, there's always a risk for you to develop new stones. It's not hindi yung, eto ba yung bato ko dati na nailabas ko na, bumalik? No. Nailabas mo na yon. It's just that
Gumawa ka lang uli.
gumawa ng bago. So when we say diet modification, sadly, this has to be a lifetime diet modification. You really have to change your lifestyle. No? High water intake and your dietary modifications, it has to be continuous.
Pero may kinalaman ba yung, kunyari calcium stone former ka, may kinalaman ba yung pagkain mo ng mga dairy products o pag-inom ng milk sa pagde-develop ng calcium stones doon sa iyong kidney?
Not really. No?
Okay.
Pag sinabihan natin na calcium stone ang meron ka, it doesn't mean na bawal ka na ng calcium. No. You're actually recommended to, there's an actual recommendation on the amount of calcium that your body needs. Actually, if you reduce your calcium, chances are you're actually going to develop kidney stones, calcium stones.
Oh.
No, baliktad siya.
Talaga?
You are supposed to maintain a normal amount of calcium in your body. Yes, if nagkaroon ka ng excessive calcium intake, usually this happens to people who take calcium supplements. No? Take note, ang recommendation for your calcium supplements, usually 500 milligrams lang yan once a day. But there are those na parang gusto nila three tablets ininom na, yan, yes, that is a risk factor. Too much calcium supplements. But if you develop kidney stones, it doesn't mean bawal ka na sa dairy, bawal ka na sa milk. No. We still recommend that you take the normal amount of calcium that your body is supposed to be taking daily.
Okay. So, yung mga indikasyon na posibleng meron kang kidney stones na nararamdaman mo, yung ang pain sa pag-ihi, yung bang nabanggit mo kanina, Doc, yung pain sa tagiliran, kasama ba yan?
Yes. So, that's a good question. No? Na-skip ko nga pala yun. So, the symptoms na pwedeng maramdaman ng isang patient na may bato. Number one is, Doc, biglang may dugo yung ihi ko. Okay? So, yan, blood in the urine. Next, pain sa tagiliran, flank pain. Sudden, sometimes severe flank pain. Yung iba, from 0 to 10, sabi nila 5, yung iba 9. No? So, variable yung degree or severity of pain. Pero prominent siya either left or right side, pero ang alam ng pasyente nasa tagiliran siya, flank area. Tapos minsan ang description is, Dok, parang siyang gumagapang papunta sa harap sa may singit ko. Okay? Yun yung description nila. Kapag ang bato ay nalaglag into the ureter, yun yung nararamdaman nila. Na parang it's creeping down papunta sa may singit area. Yun yung sensation ng isang patient na may kidney stone na nahulog into the ureter. So, 1, blood in the urine. 2, flank pain or pain sa tagiliran. Those are the 2 most common symptoms na meron ang isang pasyente na may kidney stone or stone na nahulog into the ureter.
Okay. Ngayon, kung hindi ka sigurado, wala naman yung mga simptomas na yan na nararamdaman mo, pero pwede ka bang uminom ng sambong? Just to make sure na may maifa-flush out ka na pwedeng na-form na stone sa iyong kidney. Or kahit na wala naman stones, pero pwede ba na gamitin? Pwede bang gamitin na parang everyday, supplement?
Not really as a supplement, but of course, there are some, uso kasi yan here in the Philippines, gumagawa ng sambong tea. Lalo na kung nasa labas lang ng bahay mo, may dahon ng sambong. Na yung iba naglalaga. Yes, it's okay.
Okay.
But when we say na take sambong to prevent stone formation, no, not to that extent. I would rather tell you na just have high water intake to prevent stone formation. I will not suggest na mag-herbal supplement ka ng sambong to prevent stone formation. No, not to that extent. But if nakaugalian ninyo na nagsasambong tea, sure, that's okay.
Okay. Dok, ngayon, yung ating mga tagapakinig at tagapanood, baka gusto kang bisitahin, magkonsulta sa iyo. Saan ka ba pwede nilang pupuntahan, Dok?
Dalawang clinics ko, no? One is in Manila Med and another one is in St. Luke's, Quezon City. You can drop by in Manila Med, MWF. I'm there usually 10 in the morning. In St. Luke's, Quezon City, I'm there in the afternoon, 1 p.m. to 3 p.m.
Okay. Doc, thank you so much at maraming salamat din sa Philippine Urological Association sa pagpapakilala sa amin sa iyo. Napakaganda nitong ating pinag-usapan at napakalinaw ng ating naunawaan tungkol sa kidney stones. Doc, maraming salamat.
Thank you also. Thank you for having me. I hope I was able to help you.
Yes, Dr. John Mark Garcia, isa pong urology surgeon. Doc, thank you so much. Bye!
Bye!